Good afternoon. My name is Lillian Sung. I'm a pediatric oncologist at the Hospital for Sick Children, and I'm pleased to talk about this really important problem of antimicrobial resistance, or AMR. So as a pediatric oncologist, I treat children with cancer. Most people get very sad when they hear about children being diagnosed with cancer. However, the good news is that we can cure more than 80% of children diagnosed today. However, that means that about 20% of our children we cannot cure. Sometimes we cannot cure the cancer because the cancer is too aggressive and we don't have good therapies. However, for a substantial number of children, they do not survive because of toxicities of therapy, including infection, where AMR has a really important negative role. When children receive intensive chemotherapy, they're more susceptible to infections, and some of those infections can be life-threatening. And the risk to a child's health is greatly increased if that bacteria is resistant to antibiotics. In other words, if there's AMR present. So AMR directly reduces our chances of curing a child with cancer. But AMR has impacts beyond just increasing the risk of death. It causes morbidity. In other words, it can make children really, really sick and have to go to the intensive care unit, have to require breathing tubes or other type of assisted devices to continue to survive. And in addition, if AMR is present, it means that we have to routinely use antibiotics that are more powerful. That means that not only are these antibiotics typically more costly, but they're associated with side effects, such as reactions or organ toxicity. In addition, there is an important psychological consequence of AMR. So when children are colonized with bacteria that are resistant to antibiotics, they're typically put in isolation. And I'd like you to just imagine what the life of a child is like when they come to hospital and they have to be isolated. They're put into a hospital room. They're not allowed to leave the hospital room. People have to glound and glove when they come into the child's room. So it really can reduce a child's quality of life. And also the psychosocial stress on a parent cannot be understated. So the impact on the family and the parents of knowing that their child is colonized with an antibiotic resistant to antibiotics. So children with cancer who receive intensive chemotherapy are at higher risk of invasive infection. What that means is when children present with fever, we need to have a way to manage children in a standardized fashion to make sure that children expeditiously receive the care they need, which includes antibiotics. Now, to make sure that children receive the right care, we need to deliver care according to clinical practice guidelines. And the way to be able to simplify what nurses and physicians should be doing is to create care pathways adapted for individual centers. What that means is that children can receive the right antibiotics at the right time that considers the exact resistance patterns of bacteria at their institution, in addition to knowing what drugs are routinely available on your hospital's formulary. In other words, adapted care pathways are really critical to providing optimal care for children with cancer. So just putting all this together, AMR is critically important. It directly impacts on survival and morbidity for children with cancer and can have a profound impact on psychological health and quality of life for our patients and our families.